Canada's long-term care homes are ground zero when it comes to the COVID-19 pandemic. Actually, Canada has the dubious distinction of having the highest number of COVID cases in long-term care, according to an early study in the pandemic. Here in Ontario, yesterday saw a 2-week spike in the number of cases. The grim toll has sparked calls to get to the bottom of the carnage. Hello and welcome to the Unpublished Cafe. I'm Ed Hand. While everyone at Queen's Park is on the same page when it comes to helping people in the pandemic, it appears the search for truth when it comes to ground zero is being swallowed up by politics. The Ontario government has announced a commission will look at why long-term care homes were hotbeds of infection. But that doesn't go far enough for some. Opposition leader and Hamilton Centre MPP Andrea Horwath put forward a motion this week calling for an inquiry, but it was voted down in the legislature. Andrea Horwath is joining us via Zoom call, which we can tell is bringing us some technical difficulties, but we do not want to edit her message. Let's talk about the legalities of a commission versus a public inquiry. Which has more clout?
Well, Ed, I think a public inquiry definitely has more clout because it's completely transparent and open to the public. There is no hiding behind back rooms. There's no internal, government manipulation or management of the process. It's all done completely independently and completely transparently. And really importantly, it actually provides an opportunity for people to have their voices heard instead of the government deciding who gets to speak or who gets to participate. Public inquiry will allow all those families who have faced so much tragedy, not just during COVID, certainly during COVID, but we all know for decades now that system, that long-term care system has been broken, and we need to be honest about it, be transparent about it, so that we can actually fix it.
Did the Conservatives not originally say that they would hold a public inquiry?
Well, I think what they had said is from the beginning is that they would review the situation, and then they've come up with this process of a commission as opposed to a public inquiry, which really shortchanges Ontarians. People deserve to know what's been happening in long-term care, and they're hiding behind this bogus idea that a public inquiry is going to take years, and we have to start fixing things a lot sooner than that. It doesn't take it may take some time to get to the final report of a public inquiry, but certainly in the interim, that's what happened in SARS, and that's what should happen here. In fact, we don't even need an inquiry to start making some of the fixes right now.
Well, what could we do right now? What fixes do you want to see done?
Well, we have a private members bill that we asked the government to pass on Wednesday, and that's to have a guaranteed 4 hours of hands-on care in long-term care for every resident. We know that one of the big problems in long-term care is that the work is underpaid, and people have to work 2 and 3 jobs just to be able to make a living. So we want to see much less part-time work, much more full-time work. We want the government recognized during COVID that these frontline healthcare heroes, PSWs in long-term care, are doing all kinds of heavy and difficult and challenging and such important work, and we're terribly underpaid, and they have been for decades. And so we need to get that pay scale up to pay that, but before COVID and after COVID, they worked their hearts out for our loved ones, and they have not been recognized for it. So pay needs to be dealt with. We know from the Wetlaufer report and the SARS report that makes a huge difference in terms of the ability to contain outbreaks, for example, of any kind of infectious disease. But it also makes a difference in terms of the quality of care for people who are residents in long-term care. There's also recommendations around staffing levels and ratios of staffing and making sure that every single shift has the appropriate number of staff. Again, things are not unknown. Tragedy governments, the previous, that they see half of Ontarians, we were asking those questions back in February and March. Are they ready? Are they ready for what might happen in long-term care? And the minister assured us that they were ready. And of course they weren't. And now here we are with the horrifying tragedies unfolding each and every day in long-term care.
Andrea Horwath joining us in the Unpublished Cafe as we talk about at least the NDP's desire for a public inquiry. Well, everybody in opposition, Green, Liberal, and the NDP calling for a public inquiry. Conservatives think an independent commission is the way to go. Now, the Conservatives point to speed being a key factor here. Is that really a big deal for you?
No, I don't. I think that's simply what they've dug up as their excuse for not going to a public inquiry. I think it's really clear that a find and fix inquiry can be undertaken, and that's what the public needs. I get concerned because what we've seen over the last month or so, since the end of March, actually, we've seen a number of high-profile Conservative insiders register as lobbyists for privately run long-term care centers and long-term care companies to lobby Mr. Ford and his government about long-term care. So it seems to me that where there's smoke, there's fire, and it's very curious that these private companies are trying to have an ear to the government or trying to get an ear of the government at this point in time when the issue of a public inquiry is at the forefront. Because I think one of the things that needs to be looked at is the difference in quality of care and the number of deaths and the number of outbreaks in privately run for-profit facilities versus not-for-profit and publicly run facilities. There's an issue there, and I think Mr. Ford and his friends, who own these big corporations, whose shareholders, receive profits and dividends from long-term care, don't want to see us, look carefully at the role of profit-making companies in our long-term care system. That's troubling.
What would you like to see in the terms of reference for a commission?
Well, I mean, I don't want to see a commission. I want to see a full public inquiry process, and so that is an issue, though. I mean, this is the problem, right? When the government scopes these things too narrowly, then we don't get the answers we need. So similarly, there was a public inquiry. You'll remember those the nurse Wettlaufer who murdered those 8 patients or those 8 residents in long-term care in southwestern Ontario, right? And that public inquiry was scoped. It was narrowly scoped to only deal with what was going wrong in long-term. Have been a full, broad public inquiry. That's what we were asking for, and unfortunately, the Liberals refused to do so. And I have been thinking a lot about whether we had that proper, full public inquiry a couple of years ago, whether we wouldn't be in a better position now to have been implementing changes that might have protected all of those folks who have lost their lives during COVID-19 from catching the disease.
You've been around Queen's Park for a while. When did long-term care facilities start declining in your eyes?
Well, when I started at Queen's Park in 2003, they were already in a crisis. And we have been advocating for years and years. In fact, I was saying earlier about the private members bill for 4 hours of hands-on care. When I first started, we were advocating for guaranteed hours of hands-on care. And at that time, it was so long ago that we were advocating for 3.5 hours. But the acuity levels of residents have increased, astronomically over the last number of years. So people have comorbidities. They have more dementia. There's more behavioral issues. And so, now we're saying 3.5 hours isn't enough. 4 hours is now the new standard.
Mm-hmm. Andrea, I was wondering, how would you like to see long-term care look after the commission has completed its work?
Well, I mean, I think one of the most important things is that we actually have to start making changes that are necessary to give our seniors and our most vulnerable loved ones the quality of life that they deserve. The quality of life, the quality of care. I mean, maybe it's time to completely rethink how we deal with seniors' quality of life and how we deal with supporting people as they go through the aging process. I mean, maybe it's time to revision exactly what we want to see. As we know, demographically, we're going to have many, many more seniors in the next number of years. Now's perhaps the time that we don't just stick to the old model. And I'm not talking private versus not-for-profit and public. I'm talking the whole ball of wax. What are we doing in home care? What's happening in other parts of the world? There's some really great things that are happening in seniors' quality of life and choices for seniors as they go through the aging process. There's a lot of great stuff out there, and maybe now is the time for Ontario and Canada to take a hard look at changing things up completely to make sure that folks can age with dignity and with the supports and the quality of life that they deserve.
I'll be honest, we've done a number of shows on the Unpublished Cafe on long-term care and COVID. And, in some of in particular, the advocate groups, national strategy is the phrase I've heard a lot. Now, and you talk about, the whole ball of wax. How do you feel about the federal government possibly taking over long-term care? You mentioned home care and all that from the provinces to bring in national standards as opposed to each province having a different standard.
I don't have a problem with pulling the idea of pulling long-term care into the Canada Health Act and making sure that there's requirements or standards. But I do have to say, we've heard this before with childcare, and we've heard it with housing, and we've heard it on a number of different files. And look, what we know that the big changes that have happened in Canada, things like our Medicare system, happened because one province at that time it was Tommy Douglas in Saskatchewan, took the reins and actually made the changes, and other provinces followed suit. And then finally, the federal government made a national program. And, I'm not prepared to sit as an Ontario leader, official opposition leader of my party. I'm not prepared to sit back and wait for the federal government to come up with something. I think we have an opportunity here in Ontario to be leaders on this. If the Canadian government, the federal government wants to find a path forward to tie the nation together in terms of long-term care standards, that's great. But I don't think we should wait for that. I think we should be doing the heavy lifting ourselves and taking care of our seniors here in Ontario.
Andrea, I want to thank you for joining us.
Absolutely my pleasure, Ed. Absolutely my pleasure. Thank you for inviting me.
Andrea Horwath, the leader of the opposition at Queen's Park and an MPP for Hamilton Centre. Now it's time for you to weigh in on the unpublished vote question. Should the Ontario government conduct a public inquiry into long-term care homes, or is a commission good enough? We want to hear from you on this crucial issue facing us today. I want to thank my guest, Andrea Horwath, opposition leader at Queen's Park, NDP MPP for Hamilton Centre. And I want to thank you for listening to the Unpublished Cafe. Stay safe. I'm Ed Hand.